Hello everyone and welcome to this audio podcast. This audio podcast as part of a Corpuscle Quake, part of the Corpuscle Quake edition. This audio podcast as part of a Quake and Storm. This audio podcast as part of a Bostics Quake, and this audio podcast as part of a Storm Bostics production. In this audio podcast, a little bit around sort of the renal guidelines, in around the renal guidelines. So the number of patients taken into renal replacement therapy programs has gradually increased over the past decades. This may be due partly to improvements in dialysis, in around renal replacement therapy and dialysis techniques, and better availability of KRT modalities, KRT or kidney replacement therapy modalities, and sort of initiatives. However, the pattern of the cause of end-stage renal disease or end-stage renal failure, ESRD or ESRF, also has been changing over time. Retrospectively, in 2008, the Kidney Disease Improving Global Outcomes KDIGO initiative made recommendations that all countries should have a targeted POCT program, point of care testing program, for CKD, focusing on patients known to have primary health conditions. One investigation suggested that measuring the serum albumin creatinine ratio (ACR), preferably on a first void morning specimen, by implementing POCT in all at-risk patients or recipients, is important. Various investigations and tests can be utilized to screen for early signs of disease, or to assess the risk of disease. For example, commonly referred investigations that are carried out, that are normally carried through in amongst primary care. Alongside this, service providers and policymakers should view CKD as a public health problem issue, and consider prompt inventive sort of POCT, point of care testing programs to address the growing patient population. That draws this audio podcast to a close. This audio podcast as part of a Corpuscle Quake. This audio podcast as part of a Quake and Storm. This audio podcast as part of a Bostics Quake, and this audio podcast as part of a Storm Bostics production.